Hello, everybody, and thank you for joining us on our November webinar series. Today is all about diabetes. So it's going to be a little different than what you might be used to. Today is going to very much be an education session to really teach you guys about the pathophysiology of diabetes, what we need to be aware of, risk factors, you name it. So my name is Sarah Michaels. For those of you who don't know me, I am the Vice President of Kinetiq Health here at Apex Benefits, and I am also a registered nurse, still currently practicing down at Riley Hospital for Children. I joked with my team today. It felt like we were going back to nursing school a little bit today as we were prepping for this webinar. But as you guys know, diabetes is a very prevalent topic, and so we're excited to bring this to you from a clinician view here today. I will say that none of this advice should replace those of your medical experts. This is just a teaser into things you should know. But if this really resonates with you, I encourage you guys to carry on these conversations with your primary care physician following this webinar. And I'll give you a list of resources as well to keep the conversation going. So with that, I want to go through some general housekeeping rules, things to think about. If you've not joined a webinar before, GoToWebinar can be a little confusing for some, so I want to make sure you guys know you are in listen-only mode, so have no fear. There's no muting that needs to be done. If you do have any questions that you'd like me to answer live here today, feel free to put those on the right-hand side of your screen. You'll see a little area that you can chat. Also on the right-hand side of the screen, you're going to see some handouts. So we're going to talk about some really good resources that I will be using to educate you on today. They're also going to be available for you guys to print off both now and after this webinar. If you need audio, if audio disconnects at any point in time, make sure that you know you can also call in using the phone audio feature. And like I said, this is all going to be available for you to download and follow along. So with that, our agenda today, we have a lot to pack in to 30 minutes. So I'm going to try to get through the main points here today, but want to talk about the different types of diabetes, although the majority of this presentation is really going to focus on pre-diabetes and type 2 diabetes, because that's the area that we're really going to be able to make a tangible impact on. We're going to talk about statistics to really make you guys aware of why we're even spending time on the conversation today. Talk a little bit about comorbidities that go along with diabetes and some side effects you might see for continued high blood glucose levels. We're going to talk about warning signs and symptoms. So we say type 2 diabetes can actually be a silent killer. Some people don't even know that they have it. And so what are symptoms that we should start to be aware of before they get serious? Early prevention and identification. So what labs are available today that I can actually test myself and know what category I fall into, as well as managing diabetes. So if we have diabetes, which many of you on the call today might have already been in that pre-diabetes, diabetes range, we're going to talk about how do we help you guys manage. And although diabetes is a chronic condition, there are things we can do to actually, some doctors say reverse diabetes, others say you put it back into remission. We can't necessarily cure it, because to cure something, it means to do away with entirely. And we know that based off risk factors, diabetes can always come back because a lot of it is lifestyle management. However, we absolutely can put this in remission, meaning we can start to live a healthier life and hopefully one without diabetes into the future. We're also going to share additional resources, like I said, at the end of this presentation. All of this can be clicked on when you download the PowerPoint, and so you're going to have the resources right at your fingertips. And with that, I, as a nurse, am going to share a little bit about the pathophysiology of diabetes, because hopefully if you guys actually understand, like, where does this come from, it's going to be a little bit easier to know, okay, what do we actually need to do about it to treat it? So first of all, diabetes is chronic, which means it is long lasting, and it's a health condition that essentially at a high level, it's going to affect how your body turns food into energy. And in order to do that, your body, when I eat the food, it's going to start breaking it down when it comes out of the stomach into glucose. And once that happens, it's going to release it back into the bloodstream. When that occurs, your body at the same time is going to have to get that glucose into cells to actually use that glucose as energy. It can't just hang out in the bloodstream. And in order to do that, your body signals to the pancreas, hey, we need you to start releasing something called insulin. And insulin is a hormone produced in the pancreas. It goes out into the bloodstream. And I like to think of insulin as kind of the lock and the key method. So in order to get that glucose, which is blood sugar, into my cells to use as energy, the insulin is going to act to unlock that door of the cell and let the glucose in. That's the easiest way to kind of understand where we're going. And so with diabetes, there's a couple different things that might be happening. The first is that my body might not produce insulin at all, and as a result, that sugar is going to stay in the bloodstream because that door is not opening to put it into the cell. The second thing that might happen is my body becomes a little bit resistant to the insulin. So it's still producing insulin, but I'm trying to unlock that door and it's stuck. So same thing's happening. That glucose is actually staying in my bloodstream. That's high level, kind of what you need to know. We need sugar to create energy for our body to function. And that sugar can only turn into energy if it enters into our cells, which is what insulin is allowing it to do. Okay, so if you're following me on that, let's talk about the different areas of diabetes. I added pre-diabetes. No, it's not diabetes, it's pre-diabetes, because that is really prevalent to what we're going to talk about today. This is a condition in which the blood glucose, which is your blood sugar, is higher than it should be, so higher than a normal value, but not quite high enough yet for a diagnosis of diabetes. People with pre-diabetes are at increased risk eventually to develop type 2 diabetes. They're also at increased risk for heart disease and stroke, so it's absolutely an area of focus. Now, the two main types of diabetes that you're going to hear about are type 1 and type 2. And you can read a little bit on the screen, but type 1 diabetes used to be known as, the childhood diabetes. You typically see it very quickly. The symptoms come very quickly, usually diagnosed in your child and adolescent ages. And this is essentially the term I like to call is insulin dependent, because what's happening here is the pancreas, for whatever reason, stops producing insulin. It's an attack on our immune system, an autoimmune issue, where essentially our autoimmune system is attacking the cells that are creating this insulin, and so I'm no longer creating the insulin. And as a result of that, my blood sugar is going to start to rise in the bloodstream. Insulin dependent, because these people rely on insulin to live. They have to be taking insulin every single day since their body is not naturally producing it. Whereas in type 2, it's a condition characterized by the high blood glucose sugar levels, but it's caused by two different ways. The first is either a lack of insulin, so in a similar way, the pancreas is just wearing out, so it's not producing as much insulin to keep up with the demand of the sugar. Or, and more often than not, it's producing insulin, but for whatever reason, our cells are not reacting to that, and so it's not letting my sugars into my cells the way it should to convert that to energy. That's more common, and a lot of that research shows has to do with lifestyle. Obesity being the #1 driver, what we eat, our physical activity. And the third one I added on here is gestational. It's one that you hear with pregnant people sometimes. It develops in pregnancy. There's really not a known cause as to why it develops in pregnancy, and it typically will magically disappear right upon the delivery of the child. This does come with some health risks for the mommy and the baby, so it's important that it's managed throughout a pregnancy. That's why a lot of people know that little sugar drink that you drink when you're pregnant. They're really testing to make sure if you have gestational diabetes. And like most of this presentation, a lot of it can be handled with some lifestyle modifications. So I put that on there just because it's a phrase that some of you guys might have heard. What are the stats? Let's talk about the stats and why this, again, conversation is being had. So diabetes affects roughly 11.3% of Americans today. That number is expected to rise to almost 20%. So 1 in 5 US adults having diabetes at some point in their lives. Type 2 diabetes is by far the most common diabetes. It makes up 90.9% of all diabetes in the country. That's followed by type 1 diabetes, just shy of 6%. What I think is most startling on this slide is that nearly 2 in 5 Americans will have pre-diabetes, and 80% of those people do not even know they have it. And that's because, like I said, it's kind of like that silent thing that comes up, and until it's really serious, you might not know you have it. And so we're going to talk about what you can do to get ahead of that. Diabetes is the 8th leading cause of death here in the US today. And data shows that for someone that has a diagnosis of diabetes, their spend is 2.3 times more on healthcare than a non-diabetic. And they average about $16,752 per year in claims. And I say those are people that have a diagnosis because, again, we know there's a large majority of people that don't yet have that diagnosis but would fall into that category. The good news is, with all these startling stats here, a healthier lifestyle can prevent 90% of prediabetes and type 2 diabetes cases. So although type 1 diabetes is something that is this autoimmune condition that's still not a really known cause, and there's no cure, unfortunately, for that, type 2 diabetes, prediabetes, absolutely has areas that we can impact to not only prevent, but also try to help, again, not cure, but help put back into remission and live a healthy, long lifestyle. So what happens if we let this blood sugar over time build up in our body and we don't do anything about it? Well, that is why diabetes is that 8th leading cause of death. Most of the time, it's creating one of these things to happen that's on your screen today. I put some of the most common ones, but something really important to know that diabetes is the leading cause of blindness, end-stage renal disease, and non-traumatic lower amputations that we see within a hospital. That's a lot, right? Blindness, amputations, kidney disease, all the direct result from letting our blood sugar levels rise in the body and not doing anything about it. Okay, so our goal in this webinar is really to educate you guys, not even on the medication. We're actually not even going to touch medication today. What we're going to talk about is that lifestyle modification and the interventions that can be done to reverse this without even having to take medications. Why all this happens is because when blood sugar will build up in our blood cell, what starts to happen is our nerves start to get damaged. And so you're going to see here, when those nerves get damaged, it's leading to all these other things because our blood vessels just cannot keep up with it. Also, you're going to see that 8 out of 10 individuals with diabetes end up dying from a cardiovascular related disease. So it absolutely puts strain on our heart, puts strain basically on every part of our body. So it's super important that we're taking care of ourselves as a whole. In terms of, I have a quick test, and you guys can either click this link to follow along with me, or of course, I encourage you all to take this following the webinar. But these are some things to think about in terms of type 2 diabetes. What is your actual risk factor? So the first is, how old are you? So the older you are, the increased risk you have for type 2 diabetes, because this is the one that we said is more often than not adult onset. Although they've even gotten rid of that title because we're starting to see obesity younger and younger. So childhood obesity absolutely can lead to type 2 diabetes sooner than even adulthood. The second is, what is your gender? We know that males are more likely than females to have undiagnosed diabetes. The reason for this is likely due to males are less often to actually be going to their doctor. And so when they're going to their doctor, they're oftentimes sicker. It's a more advanced stage. Whereas females, if you're going to your annual review, you're getting your labs drawn, this could be caught much sooner rather than letting this progress further. The third is, do you have an immediate family member with diabetes? This actually is true for both type 1 and type 2 diabetes. If it runs in your family, you're more prone to essentially also have this. The fourth is, do you already have a diagnosis of high blood pressure? This is, if you think about it, similar. If you have high blood pressure, a comorbidity, a situation is oftentimes obesity as well. So they kind of go hand in hand. Number 5, are you physically active? We know an active lifestyle is actually going to help use that glucose. We need energy to work out. So I'm using more and more glucose. That's going to lower my risk of diabetes. However, if I'm not physically active, all of that blood sugar is just going to stay in my body, right? So it increases my chance of type 2 diabetes. The sixth one I want to pay attention to, what race or ethnicity best describes you? Believe it or not, people with certain ethnic backgrounds are more prone to getting type 2 diabetes. It's unclear why. There's still a lot of research to see, is it socioeconomic related or what is the reason behind that? But Black, Hispanic, Native American, and Asian people are more likely than whites to actually develop type 2 diabetes. So what signs and symptoms should I be watching for? In nursing school, we learned the 3 Ps, polyuria, polydipsia, polyphagia. Let's break down why these are common symptoms of diabetes. So polyuria, you're urinating more frequently, especially at night. If you're somebody who notices you're waking up a lot at night to go to the bathroom, this could be one of your first telltale signs. And what goes hand in hand with that is polydipsia. You're feeling very thirsty. What's actually happening is your body has all this extra stuff in their bloodstream and it's trying to figure out how to get rid of it. And a natural way for our body to get rid of things is through our elimination system, right? So we're urinating more frequently as a result to stay hydrated. We're drinking more frequently. These are actually 2 of the first signs that some people have to go to the doctor to get their levels checked. And polyphagia is feeling hungry all of the time. If you think about it, your stomach has these blood sugars and the insulin should be triggered saying that, hey, I need to go get this because I just ate, I need to put it in my system, but that there's a breakdown with diabetes. And so you're actually feeling hungry all the time. The one symptom I added on here specific to type 1 diabetes is weight loss. This is something that a lot of people notice if their child starts losing weight suddenly with no known other condition. We always encourage them to go get their labs drawn for this. The reason being, if my body cannot get energy from the way it should, from these sugars in my body, it starts breaking down muscles and breaking down fat, and that's what it uses to start creating energy. So as a result, rapid weight loss is actually a telltale sign of type 1 diabetes. Type 2 diabetes, this is something later on that people might notice when it progresses and gets worse, is tingling, pain, numbness in the hands and feet. That goes back to that nerve damage I talked about when the sugar just starts building up in the bloodstream. So other things I say is your eye vision. If your vision starts to become blurry, you go to an eye exam. That's one of the top ways to also catch this. That again means it's progressed further because now it's impacting our nerves, and then extreme fatigue goes right along with that. So those are most of the signs and symptoms. Like I said, with type 2, you might have none of them, and so you might not even notice it's happening. And that's because it is a very long-lasting condition. It's slowly building up over time, and so your body just learns to adjust to that, to the changes that's happening in your body. So how can I actually prevent and identify a condition before this gets worse? That's the nurse in me. I go to all of my clients and I say the same thing. Please get to the doctor. Doesn't matter what insurance plan you're on. We have this lovely thing called free preventative care. It means that every single year you are entitled to go to the doctor for your annual physical wellness checkup, and part of that annual physical should be a lab draw. So make sure that you're asking the doctor before you're being seen at the physical to do pre-workup of labs, to run all of your levels. It's going to look at your cholesterol, but it's also going to look at your blood sugar levels. You should be doing this at least once a year. So what is an A1C? An A1C is the simple blood test that gives you a picture of your average blood glucose, which is your blood sugar levels, over the past 2 to about 3 months. We say it's tested at least annually. Some people, especially if you have diabetes, we want to test it twice a year. This doesn't have to be fasting because, again, it's looking at about 3 months of history, not just the past 24 hours. And it actually does this by looking at how much glucose is actually attaching to a protein called hemoglobin, which is hemoglobin A1C test. And that's found in your red blood cells. Why 3 months? That's about the lifespan of hemoglobin, right? The higher your blood glucose levels are, the more hemoglobin will have glucose actually attached to it. And it's going to be shown as a percent. So what you're going to see here is the 5.7% to 6.5% means that you are in that pre-diabetes range. If it's above that 6.5%, that's when we actually start a diagnosis of diabetes. And if you have diabetes, our target is always to try to stay below the 7%. And 7% would mean that 7% of your hemoglobin has glucose attached to it. It's kind of the easy way to look at it. It does three things. We can use an A1C to either identify where we fall. Are we normal, pre-diabetic, or diabetes stage? It can diagnose, as I said, if it's greater than 6.5, we're talking to diagnosis now. And then it can monitor treatment and performance over time, because if we're adding in these lifestyle modifications we're talking about today, the goal would be our percentage slowly starts to decrease lower and lower as the months go on. And I say give yourselves at least a year from the time that you're actually really implementing a good diabetes prevention program to start to see these actionable changes within the lab results. Okay, you've done that. My levels are showing pre-diabetic or diabetic. Now what? The answer is don't fret, because the really, really good news is research shows that lifestyle change programs, and these are offered by lots of different places. The one I'm going to talk about today is the National Diabetes Prevention Program. It's probably one of the most well-known ones. This has been proven to cut the risk of developing type 2 diabetes by half, so almost 60%, and or actually reversing type 2 diabetes, because we're targeting the same things. At a high level, we're targeting weight, physical activity, and what we eat. Doesn't matter if we're in the pre-diabetes or type 2 diabetes stage, we're targeting those three things. And if those three things are done successfully, we're going to start to see a shift backwards. CDC has this incredible resource, and I put it on the handouts on the right-hand side of your screen, and it's a guide. And the guide breaks down 6 really to digest steps. So if you're not ready for a full-blown, I'm going to go to this prevention class and I'm going to stick with it for a year, and you're just like, how do I just try it myself? These are going to be the 6 things that we really talk about today. It's identifying what is, first of all, your motivation. If you've done any sort of health coaching, you know that we first need to identify, am I ready to actually make a change and stay committed to making that change? Once I said, yes, this is my motivation for it, we're going to actually set a weight target goal. So how much weight do I need to actually lose to make this noticeable shift? The third is making a nutrition plan, because we know that diabetes is all about food. It's all about the carbs that we're eating. It's the sugars we're eating that's turning it into the energy. So we have to make a nutrition plan. We have to stick to that nutrition plan. And of course, set a physical activity goal to help us use up some of the extra energy. Like anything, we want to track our progress, what's working, what's not working, and of course, identify the supports we have to keep going, because this is a chronic condition, so we're going to need that support throughout the remainder of our lives. So identifying my why, right? What is your why? If you're listening to this, you're here today for a reason. What is your motivation to make a change? Okay, so for some people I talk to, it's, I just had grandchildren. I want to be able to run around with them. And for others, maybe you have kids of your own and you want them to see you living that lifestyle. And so what is your motivation? And then think further to say, what do I want to look like? Like, what kind of life do I envision and how am I going to get there? And that really starts this whole conversation. Step 1, figuring out what needs changed. So if you think about your current habits, especially when it comes to nutrition and it comes to physical activity, what in your current habits need changed? Okay, maybe I know I'm waking up every morning and I'm going straight to a large thing of coffee and pouring a bunch of sugar in it. Or maybe I'm going home after work and I'm just crashing on my couch and I'm doing absolutely no activity. So examine your current habits, think through your day, write things out, and think about what are things that maybe I can change that would impact either my nutrition or my physical activity. And the second thing is planning a new routine. Remember, you want to start small and you want to build up. I'm not going to put on paper that I'm going to change every single thing about my day, but I'm going to maybe pick one thing that I want to change. And I'm going to start with that one thing of when I wake up, instead of pouring that big glass of coffee, maybe I'm going to switch to tea, and I'm going to figure out how to slowly get off some of the sugar that I have. You want to make sure it's a routine, though, that you enjoy, right? Because if you don't enjoy it, you're not going to stick to it. How do you set a weight goal? This is kind of our second thing in the whole process. CDC says even 5% of weight loss is going to cut down our risk. If you get to that 7 to 10% risk, it shows that over your risk of developing diabetes goes down by over 50%. So the more weight you lose, it's going to lessen your chance of getting diabetes. But we say start at 5%, and you never even want to go over about a pound or two of weight per week. So this makes it really tangible. It's easy to achieve. So we're going to identify for your personal weight goal, what's my current weight in pounds? I'm going to calculate what 5% of that weight is. And then from there, I'm going to create my new goal weight in pounds. And that's kind of my starting point for this is my target of where I want to get. And if I can get to this weight on a scale, I know that I'm decreasing my risk for all of these other conditions that follow. Making a nutrition plan, the guide attached has fantastic resources, especially when it comes to portion sizes. That's always something we talk about. When we talk about diabetes, it used to be you can't eat any carbs, eliminate all carbs for your diet. It's going to solve all these problems. But the reality is there's still going to be a lot of foods that you love that have carbs in them. So it's all about portion and control and knowing what your sugar levels are. And if I'm adding exercise in my routine, maybe I do need those carbs because I need that added sugar so my blood sugar level doesn't just crash and flat out, right? The biggest thing I encourage if you're on this journey and you haven't yet met with a registered dietitian, make sure to ask your doctor to put in that referral. If you don't know where to start, even here at Apex, we have a registered dietitian on staff, something that we are happy to provide resources to get you connected to. But start with an RD. Make sure you find somebody who understands what your levels are, where you're hoping to get, and creates that meal plan to get you there. I put some foods on the left-hand side of your screen that are ideal. The biggest thing is that fats are actually encouraged. So it used to be, you don't want to eat fatty foods. Fats actually will make you feel full without getting all of those carbs in there. So you still want to add some fats into your diet. On the right-hand side of the screen, the biggest thing to note is those sugary drinks, right? They're high in calories, they're not filling our appetite, but they are boosting up our sugar. So the number one thing, if you have a tangible thing to do, is to try to eliminate as much as possible those sugary drinks from your diet and figuring out other ways to get those healthy nutritions into your body. People, especially with type 1 diabetes, would say it's hard to eat out. It's a lot easier to start to meal prep and to cook in. So you can do lots of Google to find lots of good recipes to make. But they'll always say, like, eat when you're hungry. Don't eat when you're not hungry. It sounds easy, but if we see something on our plate, we're going to eat it. It's also all about making things convenient for us. So one thing that I actually had read that I found really interesting was type 2 diabetes has actually skyrocketed following COVID. And it's because a lot of people are starting to work from home. Well, if you think about the home environment, you've got all these distractions around you. You have screen time to create that physical inactivity. You have a whole pantry likely filled with junk food and snacks, right, that we're naturally going to, where people, when they were at work, they might have been further away from that. So it was harder to actually eat unhealthy because you didn't have all this junk food right around you. So just think about, how can I change my routine to make it easier and take some of those things and make it harder? So can I just not buy snacks to put in the pantry that are unhealthy so that I don't have that temptation to go get? And setting a physical activity, you guys have heard this before, working out about 30 minutes a day, adding some kind of movement, even if it's as simple as walking, is what's really encouraged. Believe it or not, even if you don't lose weight from doing this, exercise alone helps that insulin open that cell door. So don't need to lose weight immediately, just for it to open the cell door and slowly let some of that glucose into your body. So absolutely add exercise. We encourage 30 minutes a day, and work up to moderate activity, which you're going to see on the screen says anything that is essentially, I'm still able to talk, but I can't sing. Okay, so you don't have to be full blood. You don't have to be running a marathon, right? We don't have to be sprinting. We just need to start moving, getting our body used to that a little at a time, and find an activity we like. So find friends to do it with. Bring some music, try to make it as enjoyable as possible. The key here is you're going to find this routine that you're most likely to stick to by setting goals and creating rewards for yourself that hopefully are not food related. So how can I find either an intrinsic reward, or maybe I'm going to buy myself workout equipment or something fun that's a reward that's actually going to encourage a healthier lifestyle. And that is a lot to add in this 30 minutes. So I want to recap kind of where we're at. Nearly 2 in 5 Americans will be diagnosed with prediabetes. 80% of these individuals do not know they have it. So if you learned anything from this presentation today, I want you guys to make sure that you take that risk assessment that you're going to find on the right-hand side of your screen. If you find in that risk assessment that you are high risk, I would encourage you right away to schedule an appointment with your primary care physician to get those lab works done, because we need to identify what is that A1C level and am I at risk for diabetes, okay? Knowing your numbers can absolutely save your life. Also on the right-hand side of your screen with those handouts, you're going to find information for these lifestyle management classes. So in 30 minutes, I just covered what you guys would actually cover over the course of an entire year. So you're going to actually see a curriculum to see every little thing that they cover. If you fall into the type 2 category or if you fall in prediabetes, I really encourage you to seek out by clicking these resources. You can search by zip code what programs are available. So for instance, right here in Indianapolis, we have a lot of YMCAs that partner with our local healthcare systems to provide free grant-funded trainings. It's a great way to meet people that are in similar positions as you, meet new friends, have accountability partners, and just learn more about how do I decrease that risk by almost 60% of this from progressing further on. I also made sure to add some tools for caregivers because some of you guys are caring for a kiddo or a spouse that has diabetes. So there's great tools out there for you guys as well. One of my favorite resources to add is some people don't know that there are fantastic camps all across America, especially for those kiddos with type 1 diabetes, so they don't feel alone. So I made sure to add that in case you didn't know about that. And the last resource I put on the screen is actually a resource that I use all the time for basically anything and everything. It's a program and service directory. So if you actually click that link, you can type in your zip code and find everything from food needs to all the way to childcare needs, and of course diabetes and chronic conditions and everything in between. But that is a great resource to really help connect you, no matter where you are in the US, to resources based off of your zip code. So if you have any specific questions for the Apex team, feel free to reach out to your Kinetiq Health Program Manager. I also put my direct contact information on the screen, so feel free to shoot me an email. We are happy to have one-on-one conversations following this, especially if you're falling in those categories and unsure kind of where to start. We would love to help you on this journey. And I do want to close by saying this is actually the last webinar that we have of this year. Hard to believe we're already about to enter into 2024. We're giving you a break next month because of the holiday season. We know it's about to get super crazy, but we're super excited for you guys to join us again, hopefully next year in 2024. If you guys have any content that you'd really love to see, make sure to use that chat, send us ideas. We're going to be busy creating stuff the remainder of this year, and we want to tailor it to exactly what you guys want to see. So thank you guys so much for joining us, and I hope you guys have a great holiday season. Talk to you soon.